Welcome to Conversations with the Winners. Today, our conversation is with 2021 Robert Wood Johnson Award winner, Ilana Steinhauer. Ilana is Executive Director and Director of Clinical Services at Volunteers in Medicine, Berkshires. Welcome, Ilana.
Thank you. I'm so happy to be here.
Let's start with learning more about Volunteers in Medicine, Berkshires.
Great. Volunteers in Medicine Berkshires is a free healthcare center located in Great Barrington, Massachusetts. We provide full comprehensive healthcare to people who are uninsured in the Berkshire region. And we do that by mobilizing volunteers from the community to provide services for our clients. And we have a small staff that supports those volunteers.
Ilana, you have an approach to health equity that's quite interesting. Can you tell us more about that?
Yeah, when people come to us, they are usually they are coming because they're uninsured and they are falling within our income guidelines. And they could be coming from another country, they could be coming from our community, but they're all coming as humans. And the philosophy of Volunteers in Medicine has always been, who is the person walking into our door? And how do we treat them as a human and ensure that they are able to help define what healthcare is for them and to support them in that journey? So the patient might come in with, complaint of dental pain, but that patient will then be at the center of their care, but they'll receive medical care, dental care. They'll be offered behavioral health. They'll be offered support systems around housing and heating and food and education. And by doing this model of care, each patient, each client comes in where they are, and we're able to support them to really help them achieve what they consider to be a healthy life.
Ilana, the award you received is based on building health equity through systems change. And can you describe what's different about this approach, the systems change piece of it?
What we're able to do is we understand the systems in which we're living, and we're able to support our clients to navigate the systems and then to overcome barriers that are within the system that would prevent them from achieving health. To approach somebody as another human, and you need to approach with humility, you need to approach with curiosity. And when you do that, and you sit in that space with somebody, you develop a relationship of trust. And once that trust is formed with you and whoever is in front of you, you can then understand what do you need to do as a team, as a partnership, to achieve what needs to get done. I think we are creating situations where our patients become empowered, where they become confident. And I think slowly we are seeing that people are making their own changes within these systems, and they're starting to change the system. And our job is to help them be prepared to do some of that work as well.
Let's talk a little bit about the unique staffing model at Volunteers in Medicine, Berkshires.
So we are really lucky to be part of a larger philosophy, Volunteers in Medicine. They exist throughout our country, and the idea is to mobilize volunteers to provide care and to use a small staff to then support those volunteers. Having this volunteer model allows us to not only provide the services we do at the fraction of a cost, it would for, if this was out of pocket, but it changes why people are there and what the purpose is. It also then creates this beautiful relationship between the providers and the volunteers with the clients, because it levels the playing field,
Ilana, are you asking questions of patients that probably aren't typically asked? And what could some of those questions be?
The questions are to connect and to understand who this person is. And so our introduction for a patient who comes into our clinic is actually a 2-hour orientation, where the first hour is them understanding who we are, understanding what we're going to make them sign, what the paperwork is, what their responsibility of a patient is to us, what ours is to them, and to find out what their goals and hopes are. The second hour is about screening for social determinants. So this is before we even go to the medical. And by the time we get into the clinical stuff, the dental, the medical, we've already started to build that relationship and that trust.
For those interested in adopting some of these practices, what are some of the lessons learned that you can share with us?
I think it starts from the top. And I think it starts with what is the culture that you create for your staff? What is the culture that you are creating for your workforce? How do you create an environment in which people who are working there or volunteering feel empowered and inspired and mission focused and feel the privilege that we have, that we get to do the work that we get to do, and that the people we work with give us their trust, and that we get to create relationship and hopefully really start to dismantle some of this negativity that we see in the world.
What does receiving the Robert Wood Johnson Foundation Award for Health Equity mean to you?
This was, an honor beyond honors. For me to receive it, I think it's a reflection of our organization as a whole. It just affirms the importance of what we're doing and has really given us the motivation to continue our mission and to continue to expand and to continue to know we need to meet this need.
Thank you for your amazing work, and I thank you for sharing your thoughts with us today. And on behalf of Robert Wood Johnson Foundation and the National Association of Free and Charitable Clinics, congratulations on your award.
Thank you so much.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2021 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.